And hello, everyone. This is Laura Williamson from Bear Fitness in Stoneham, Mass. That's my brick and mortar, but here we are. We also have a show also called Bear Fitness. And today I have with me Dr. Al Costanza. Dr. Al, how are you?
I'm doing just great today. Yeah.
Yeah, and can you tell us who you are and
Sure.
tell us what you're about?
All right. Absolutely. My name is Dr. Al Costanza, and here in Wakefield, Massachusetts on Albion Street. My business is holistic health counseling and education. I've been in practice for 31 years now. And basically, I practice what's called functional medicine, sort of a combination of, think of naturopathy, holistic medicine. It combines many different modalities. I one of my specialties in medical herbology, in nutrition. We have different forms of energy medicine, anything from meridian autonomic testing to polarity therapy. I also I have degrees in Ayurvedic medicine, and also degree in psychology, and just everything. When you think of the word holistic, you bring everything to the table, because there's not any one underlying area having to do with the diet or the lifestyle that is a contributory factor. Everything matters basically with that. Yeah.
Okay, so that was a lot. So you do a lot. Is basically what that all means. Okay,
Basically.
so let's see. Okay, so let's comb through because it's evident right away that we're gonna have to have you back again. Is what how I'm translating that. So I'm putting it out there early. We
All
need
right.
you back again. So
I'm happy to.
okay, so let's start from the beginning.
Sure.
What is holistic health counseling? Can you start there?
Absolutely. So there are people that have chronic illness, okay, not acute, but chronic illness. It could be anything from a lot of chronic digestive issues of many different types. It could be autoimmune diseases. It could be someone we're going through an integrative, working with cancer sufferers, doing an integrative approach. A lot of pro-inflammatory conditions that people come to us from. So basically, my job is to figure out where the imbalances are within the systems of the body. In other words, as one of my professors used to say ad nauseum, you don't have a patient with one or two bad parts. What that means is one system affects another, affects another, affects another. And that's a very important principle. We call it systems biology. So in conventional medicine, basically you've got a diagnosis, you've got a series of symptoms, and they're giving you a prescription and medication to sort of downregulate or help reduce the symptoms, but no one's addressing the underlying cause. In functional medicine, we look at the underlying cause, but when you think of the word holistic, was it due to the fact of lack of exercise? Was it they eating a bad diet that doesn't serve them? Was it the fact that they've been exposed to different chemicals and heavy metals within their workplace? Are they not sleeping? They're not getting into deep delta level sleep. So when you think of the word holistic, it really represents many different facets of our lifestyle. And if we're not, if certain habits within our lifestyle are not serving us, then certain systems within our body, certain organs within our body, we can create imbalances. So my job is to figure out where the imbalances are, but where the underlying imbalances, where it all starts. When I use the phrase systems biology, what I mean is, for example, if a woman comes in and she has PMS or dysmenorrhea, and I may be looking at the gut because maybe she has an increase of the bad bugs, the pathogens in the gut, that gets carried to the liver by the hepatic portal veins, and the liver metabolizes estrogens and female hormones, and it has over 500 functions. So we work on the gut to help the liver metabolize female hormones, but you have to fix the gut first. So once again, when you think of the word holistic, it applies to many different facets of our lifestyle, and that's why I mentioned about a background in psychology and in naturopathy and in energy medicine and Ayurvedic medicine and nutrition, because you're looking at a person's history and their lifestyle, as many patients say to me, you know more about me than my significant other does. But holistic being what it is, everything matters. So my job as a clinician is to figure out where the imbalances are, and then after over a period of time to help them practice principles that brings their system back into balance without the use of medication, basically. So it's personalized lifestyle medicine, basically, we call it.
Okay. So for me, for my own selfish purposes, and I visited you, by the way, and I've received a prescription from you. I've received certain things because I will let everyone know that I have sensitivities, and sometimes I don't do very well digesting things, and so on and so forth. So you actually gave me something that has been working very well, by the way. And I've tried different things. I'm a person who also takes probiotics. I'm also someone who, at some point when I met you, I was also doing apple cider vinegar, and knowing the pros and cons about that, I did it knowing, I said, well, I want to try and experiment it with it, excuse me, but also thinking in terms of, well, this is a temporary fix for me, if you will. This is something I'll do short term. And then you and I sat down and we talked, and you actually did some of these things on me. Can you talk about that? Why you did what you did and what it is exactly that you gave to me? Because I will tell you, it's been beneficial in the sense that I can see in how I digest food. I find that my stomach, I'm calmer. I definitely see and feel the differences. And I even called you and I was like, I need some more of that stuff. I couldn't give you the name of it, but I was like, I need whatever you gave me. I was like, I need a fix. What can we do about that?
So basically, if you were to ask me, and this applies to your situation as well as many, what causes chronic symptoms? Mm-hmm. So first and foremost, I'm going to put stress, post-traumatic stress disorder, trauma first. Okay, most people deal with stress, and the body doesn't discern little stress from big stress. It responds the same way. Okay, so I'd say that stress first. I would put diet and exercise, or lack thereof, on the next plane. On the next level, I would put lack of deep sleep. The next level, I'd put contaminants in the environment. And at the next level, I would put infection, and then I'd put genetics. So the first things, several things I mentioned, influence genetics, either good or bad. So we have a genetic weak link, but some of us inadvertently water and fertilize that weak link. Mm-hmm. So the two most popular formulas that we dispense, and I know you got one of them, at least one of them, one's called Digestive Remove and Rescue 2, and the other one is Adrenal Endotropho Restorative. Mm-hmm. So the Adrenal Endotropho Restorative is for people who are going through stress, and it helps to restore their adrenal glands. Remember what I said, the body doesn't discern little stress from big stress.
Right.
The digestive one, because in functional medicine, we look at the gut as everything. Mm-hmm. And when you have food sensitivities, you have what's called intestinal hyperpermeability, or in simple terms, we call it leaky gut. Mm-hmm. What does that mean? Due to stress, whether psychological or physical stressors, doesn't matter. Due to stress, it causes an inhibition of digestive enzymes in the stomach that breaks down protein. It causes this leaky gut phenomenon, which means that those large protein molecules supposed to be broken down to amino acids. Amino acids is the building blocks of life. Mm-hmm. They get partially broken down. They're called polypeptides. They get into the bloodstream through the leaky gut. And if you think of it this way, so now the body sees this protein, okay, foreign substance, and a specialized white blood cell comes along like a little Pac-Man, and now you have what's called a CIC complex. It's mm-hmm. like having a sliver. If you have rheumatoid or osteoarthritis, it's like having a sliver in and around your joints. That's why today people say, gee, I'm gluten intolerant. I'm casein intolerant, which is the protein in dairy. Mm-hmm. When you look at the foods that people are most reactive to, I'm going to put dairy first. I'm going to put sugar. I'm going to put gluten-containing grains, and then soy, corn, peanuts, and eggs. Now, let's not throw the baby out with the bathwater. Some of these latter ones I mentioned, such as the eggs and so forth, people do okay with, and that's great. But if you have a food sensitivity, you want to work on fixing the gut. You want to work on re-educating the parietal cells in the stomach releases the hydrochloric acid. Hydrochloric acid, your principal digestive enzyme, breaks down protein. If the protein's not broken down, the rest of the digestive cascade sort of goes awry, and you'll be gaseous, you'll be bloated, you'll have inflammation, you could have constipation, diarrhea, IBS, IBD, colitis.
That's so much.
So much. But this is the clientele I deal with on a daily basis.
I was like, okay, diarrhea, okay, but there's more. You keep.
Oh, that's what we deal with.
I thought it would be a slightly shorter list.
Oh no, it's a long list. So gut issues are like, it's the foundation to your health. Now, when I say the gut, I'm talking from the sinuses down to the other end. Wherever there's mucosal membrane, that's where your immune system resides. So 80% of the immune system resides from here down to the other end. So what you put into your body and how your body responds to that is kind of important.
Okay. All right. So then let's go from there. So it sounds like I would ask you the question, well, who are the clients that you treat? But maybe it's easier, maybe if I pinpoint a couple of things. I know they're, again, for my own intents and purposes, I'm going to talk about weight loss, because those are some things that I know, and I know some of the clients that you've worked with regards to weight loss, and I've seen some of your testimonials. So let's talk about that, how the gut affects, what are the effects on losing weight and staying in the shape that you want to because of the gut? Or
Absolutely. First of all, you want to remove from the body what offends the body. So in terms of toxicity, okay? And so we often do like a 21 or 28-day detox program, and it focuses on the gut, it focuses on the cells, and it focuses on the liver. In order to lose weight, it really helps to detoxify. Then what you want to do is replete the body of what I call catalysts and spark plugs, basically the micronutrients that the body's deficient in. So you remove from the body what offends the body, replete the body of what it needs in terms of its micronutrients to help build the system. So that's important. The other thing is you want to put the fire out. When I say put the fire, I'm talking about reducing inflammation. If you are inflamed, and a lot of people have autoimmune disease, middle age and older. If you're inflamed, that's an issue, because when you're inflamed, it's very difficult to lose weight, okay? Because that's stressful to the body.
I don't mean to interrupt you. Can you explain to people what being inflamed is, so they know the difference? Can I ask you to do that? Okay.
Absolutely. One of the things which is less obvious, but I'll make you aware, you'll be looking for it. If somebody has that kind of like puffy look to them, it's that edema. So what's happened is the cell membrane breaks down due to inflammation, and the water shifts from inside to the outside. So anyone that has that kind of puffy look to them, that's one thing. People that have chronic digestive issues, like when you're gaseous and bloating, you have inflammation, or any of those digestive conditions that I listed earlier, okay? Anyone that has any joint issues, a little bit of RA, rheumatoid arthritis, osteoarthritis, anyone that has chronic illness will be inflamed. So it was like, I think it was the year around 2004, was Time Magazine, February issue, on the front page, it says the secret killer, and it showed a bunch of flames, and it says inflammation, the cause of heart disease, of cancer, autoimmune diseases, and it listed a whole bunch of things. I won't say inflammation is the cause of it, but it's present with a chronic illness, just about every chronic illness that you can think of. So by reducing the inflammation, putting the fire out, helps a lot. Inflammation initially has a purpose to it. It's part of the healing process. But when someone, due to their lifestyle, advertently or inadvertently is putting gas on the fire faster than you can water it out. They're continuously being inflamed. That's chronic inflammation, and chronic inflammation is a degenerative process.
Oh my God, that was awesome. Thank you. That's fantastic. I think we use the word inflammation. We use it quite often. It's going to help with that inflammation. It'll help with inflammation. But then it occurs to me, do people really know what that means and what it is?
No.
And so, wow, that was a really awesome definition of it and explanation of it. And I'm hoping that it helps someone who might be going through that right now as we speak. So for you now, how did you get into this aspect? How did you get into holistic health?
Okay. I never planned a career in this field. In my previous life, I had a series of music schools. I built and repaired musical instruments.
Uh-huh.
And then but I had a family that was plagued with chronic illness, from lymphoma to heart disease, to diabetes, to Parkinson's disease, to rare autoimmune disease, cystic Guillain-Barré syndrome. And I spent a lot of time on Longwood Ave. I get choked up just thinking about this. At the Mass General, at Beth Israel, at the Jocelyn Clinic, and it's like I spent more time there than any place. And our kitchen cabinets were like a pharmacy. And I'm thinking to myself, this isn't normal. This isn't good. And no one's getting really better. And so I was driving home from New Hampshire, listening to this MIT professor who wrote a book on teaching his physician how to lower his cholesterol, lower his blood pressure, and lose weight naturally. Mm-hmm. Thinking, wow, this is very cool. I went out and bought the book. I outlined it. I read it like 3 or 4 times, and then I started, learning. And I went from one program to another. And I just never, that was 31 years ago. I never stopped learning. Mm-hmm. And I'm at 68 years old. I have I take no medications. I have no apparent chronic conditions. And I look at my family history, and according to my family history, I shouldn't be here by now. Yeah. So I never intended this, but once I started, it became a positive addiction for me, and I never stopped learning. Day and night, I continuously learn.
So what are the common problems or ailments, maybe I should say, maybe that's a better term, that you find that you're treating people right now?
Okay. First of all, my clientele, though I have those few in their 20s and 30s, most of them are in their 50s, 60s, and 70s, middle-aged people, mm-hmm. who have gone the conventional route and they're on multiple medications, mm-hmm. feel they're not getting any better. Mm-hmm. So you see people with chronic fatigue, they're pushing all the time, they don't seem, and medication's not the answer to that. Those with fibromyalgia, which is a chronic condition that people don't understand. So it's kind of combining chronic fatigue with some symptoms of arthritis, but it goes beyond that. Mm-hmm. You have a lot of people with GERD, indigestion, people with chronic digestive issues, a lot of gas and bloating all the time, and they don't feel well. People are not sleeping. Sleep mm-hmm. is so important. I can't emphasize it enough. And they get to sleep, but they can't stay asleep. And there's a number of reasons for that. People that have blood sugar issues, they have carb cravings big time, mm-hmm. and they feel, and they go from diet to diet, which ties in with the whole weight thing. When you carry extra weight, an adipocyte, which is a fat cell, carries inflammation.
Right.
So the less adipose tissue you have, the less inflamed you are. So the first thing you could do is work together. And this is where you and I could work together, where, I'm working on the biochemistry, you work on the body somatically, particularly in the resistance training, because people are losing muscle, and muscle is so important. And that is what I call healthy weight loss, because you're not only losing adipose tissue, but while you're doing it, you're gaining muscle. Right. And by everybody's standards in healthcare, we agree upon one thing: how much muscle you have is an indicator for morbidity and mortality. In English, what that means is whether you develop disease and how long you're going to live, because your muscle supports your immune system. When the immune system is down regulated, let's say you get in a car accident, you're a burns patient. If you're emaciated, you're in trouble. But if you have muscle, the body will go to the protein, and that supports your immune system, and then after you'll heal and survive.
Okay, so you flagged something in my mind as you were talking.
Sure.
So we talked about this briefly, and as a trainer, I don't want to call it what we call it, but for those people who are naturally thin, genetically thin,
Sure.
but then they don't really work out that often, and they're not too fit. You and I talked about that too, but you actually have a medical term for
it. It's called sarcopenic obesity. The word sarcopenia means muscle wasting. The obesity you're looking at and you say, wait a minute, they're not obese. Yeah. The ratio of muscle to adipose tissue is way off. They have no muscle. So what they have left is some adipose tissue. We call it the fat, skinny person. Okay. It's called sarcopenic obesity. And it's a phenomenon today that you see more so than when I was a child. And part of it has to do when I was a child, that your mother kicked you out of the house and you out and playing in the woods and playing with your friends and you're moving around and you were pretty active, Right. And you'd come home for lunch and then you go back out. And then after at dinner time, eat dinner, you go back out. When the street lights came on, that was time you had to go home,
Right. I know about that.
Yeah, but you were active, right? But now you have someone who's sitting in front of a computer or a device all the time and they're not moving. Right. That's the problem.
Yeah.
So that's where that comes into play. And then maybe dietary wise, they're eating a standard American diet, which is not a healthy diet.
All right. So now you lead me. Okay. So we've touched on people who are a little bit older, a little more mature, and we've touched on youth. Are you finding that your treatments or how you're treating your patients vary by age? Are you seeing something's more common in, like, say, the 15 to 20-year-old versus the 20 to 25-year-old and the 50 to 60? You see what I mean? Well, do you see any differences?
To some degree, yes and no. Let me explain. So when you're dealing with, obviously, you're dealing with more women than you do men.
Okay.
So the wife comes in, and then after she does the program and gets results, and then she brings the husband in. Okay.
Right.
But usually, I'm going to say that, and she's the one that's most concerned about the family's health and nutrition and the whole deal, right? And not to discriminate, but that's usually the way it is. So I'd say 70% of my clientele are women. Now, when you're dealing with menstruating women, yes, you have things like they'll come in with acne, and the thing is, anything to do with the skin, you always go to the liver, and for sure you'll sit down with that patient and you'll say, how are your menses? And that they have difficulty with their menses. They may have PMS, dysmenorrhea, menorrhea, because female hormones get metabolized by the liver. Remember what I said when it comes to acne, it's the same deal. You always go to the liver. So that can sort of open up a can of worms. And what happens is you don't have a patient with one or two bad parts. So if you've got an imbalance in one area, it affects another. So the principal areas that you see in both men and women is you would see some blood sugar instability or predisposed for diabetes. Some people today, because of stress, they're hooked on sugar. I mean, it's almost akin to a drug, basically heroin or cocaine. It's a true addiction. That's a problem. The other thing is stress. Everybody's so stressed today. And one thing I sort of talked about on the BNI meeting this morning was that when you're stressed, you have a valve that's between the small and large intestine, okay? And what happens when you're stressed, that valve stays open. And the problem with that is that valve separates the large intestine from the small intestine. So bacteria for the large intestine is supposed to get eliminated, migrates up into the small intestine, into the stomach, and people have digestive issues. So you see a lot of people with a lot of digestive issues, and the gut is sort of the mothership to the whole entire body, in terms of other organ systems of the body. It's so important. So you fix the gut and you're fixing all these other areas, particularly the liver. The gut influences the liver in a very big way. So you're seeing that. And then from there, we had talked about the leaky gut, and you're talking about the autoimmune people. And the autoimmune people have inflammation. It goes to the body's genetic weakest link. So remember, I talked about how that those protein molecules get into the bloodstream, but it will go to the person's weakest link. With one person, it's allergies. Another person, it's eczema. Another person's rheumatoid arthritis, osteoarthritis, might be COPD. You have more receptors in the gut than you do in the brain chemistry.
And so and excuse me not to cut you. So this is why this is so effective with weight loss, because now we're talking about lifestyle shifts and trying to eat food a lot differently. So, but what are your protocols like? How is it that you work with someone and you determine how that's going to work? I mean, I know that you've had people who've had substantial weight losses coming to see you and changing things around based on your protocols. How exactly does that work?
Okay. Basically, a patient comes in for a comprehensive evaluation. It's basically two visits. And on the first visit, I'm collecting information. So when they come in on the first visit, we start doing some what I call point of care testing. And one of them, which I did with you, is called BIA, bioelectrical impedance analysis. It's totally non-invasive. And basically, it helps to determine exact percentage of muscle, exact percentage of fat. It measures the integrity of the cell membrane. The cell membrane, think about it. Cells build tissue, tissue build organs, organs make up you. So you want to go to the lowest common denominator. So it will tell us how much water is inside the cell versus outside. When the cell membrane breaks down due to inflammation, due to toxicity, the water, you have more water outside than you do inside. That's not good. When the water's on the outside of the cell, that's associated with inflammation, toxicity, edema, water retention, muscle wasting, fatigue, necrosis of cells, mutation of cells, and hypertension because it's compressing blood vessels, okay? So there are ways of repairing the cell membrane, getting the water back inside of the cell. So this is a great tool because when you put together a plan, which I'll get to in a minute, for the patient, you can show them as they're losing weight, as they're feeling better, as their symptoms are clearing up, that their numbers are getting better. It also measures your what's called phase angle, which is sort of like your biological age. And it's very cool because as we get older chronologically, biological age, we get older as well, unless you're making positive change that is serving you. So my job is sort of, playing Sherlock Holmes to the human body, figuring out where the imbalances are. The way I do that is I do it through a series of this point of care testing. We might do some applied, if you look at my kinesiology, muscle testing. I have an app on my phone that measures heart rate variability, tells me how stressed the patient is. We have minerals that are in a liquid form, and according to the taste of the mineral, gives me an idea whether a person is deficient or not in that particular mineral. I have them fill out a questionnaire that takes them a good couple hours. They have a couple of weeks to do it at home. I have a urine and saliva test. Sometimes we do hair analysis for chemicals and heavy metals. I interview the patient for anywhere from 45 minutes to over an hour, and they say to me, you know more about me than my significant other does. Once again, holistic being what it is, everything matters. There's a saying in our field, your biography becomes your biology. What you've done in the past affects you today. So these symptoms didn't occur overnight. And the person may have been asymptomatic until they got to a certain point where they became symptomatic. And to me, that's kind of late stage. That means you had it 8 to 20 years. You just didn't know it, basically. So it's a combination of evaluating the patient on that first visit and knowing everything about their lifestyle, everything about their medical history. I look at their blood work as well. And according to their doctor, they may say, oh, your blood work's fine. No, if I see a proclivity, if something is flagged high and low and it's moving in the wrong direction, why would you not want to nip it in the bud now? A perfect example of that is rheumatoid arthritis. So in other words, when it's down at this level here, the low level on the graph scale, this is the point where you want to be proactive and intervene on that. When it's up here, at this point, when it's clinically diagnosed, at that point, some deformity has already occurred. Why not get it, nip it in the bud before it becomes an issue and before the deformity occurs?
So in that case, so when you meet with people, because we're running out of time
Right.
quickly, but when you meet with people, do they come to you with the idea that they're going to have a plan that they're going to start working out in addition to your protocols and so on? And then what happens? What happens once you have all this information compiled and you start working from there? What's the next step?
Okay. So on the second visit, I laid a whole plan for them, dietary wise. And also I put together some custom formulas for them, not to be taken forever. They usually supplement herbal formulas, and they're very aggressive because you have to re-educate systems within the body that they started years ago that got them to this place. Fortunately, it doesn't take as long to resolve it as it does to where they, to get them there.
Right.
So usually it's typically 3 to 6 months people see results. But if somebody's on 12 medications, it could take a year or two, And my job is to help them get off their medications and look and feel their best.
Where are you located, Dr. Al? Where can people find you?
People can find me at 63 Albion Street in Wakefield, Mass. It's off of the downtown area in Wakefield. And and they can book their appointments. They can do it online themselves if they go to dralcostanza.com, DRALCOST. Oh, there we go.
Yep, there it is. Give it to them, because people do things and they retain information.
DRALCOSTANZA.com. They can book it themselves, or they can call the office at 781-246-5041. Talk to one of the staff members, and they'll set it up for you. All first consultations are free. We sit and chat and see if this therapy is right for you.
And do you do virtual visits?
I do. Thank you for mentioning that. We have our own, we're on a telemedicine site, Doxy, and that works out very well. We have a virtual waiting room, and so we can work with you virtually as well. And
one last thing, COVID-19. What do you have? Do you have a plan in place for people who might be a little concerned or nervous about walking into any office building or public building itself? Do you have something in place so they don't have to concern themselves for their safety?
Absolutely. It's all about one word: immunity. Okay. Everybody's different. You work on your immune system. We can put together a protocol for you based upon your unique biochemistry, your inherent strengths and weaknesses. And that way there, you use common sense, obviously, but you live your life and don't get stressed. Stress down-regulates your immune system. You de-stress. Obviously, exercise is a great way to diffuse the stress response. And the other thing is, we teach people how to help them to get into that deep delta level sleep, which upregulates your immune system. So it's all about immunity. That way there, you go shopping, you live your life, and you don't fear, you don't have worry, and you're fine.
Okay. Any more advice before we sign off?
I would just say, I'm just going to repeat myself and say that right now with the COVID thing going on, sleep, I'd go to bed like an hour early. You get your deeper sleep in the former part of the night. So that's really important. And then do things to try to de-stress. Like at nighttime, I put on YouTube, I put on like music by Journey or something like that. And then I dance and I dance to it. And just it de-stresses you, and end up laughing, and having a good time. And it gives you that a little bit of a high, because you're singing along with it, even though you're out of tune. That's okay.
Yeah. Well, Dr. Al, thank you so much for visiting with us today. All your information is and has been very helpful. So I think that's it for us today. I am going to see you next time. Again, thank you for visiting with us, Dr. Al. And you can find him again. His information is right on the bottom there. And so is mine. So if you have any questions for Dr. Al, reach out. If you have any questions for me, reach out. And as you know, I post workouts twice a week. Look for those. And otherwise, it's been fun. And we'll see you next time. All right.
Thank you.
Bye. Have a great day. Again, thanks, Dr. Al. Bye.
Thank you. Bye-bye.